on to this anesthesia training session. Today I will be talking about anesthesia and sedation of two unique groups. I'm going to be talking about pediatrics and geriatrics. So there's many different ages of patients that we see on a daily or a weekly basis, and I always like to say that age is not a disease, but that being said, there are certain problems that we tend to see more often in very young animals and in very old animals that you do need to be aware of when you're planning either a sedation, an anesthesia, or an analgesic plan for these animals. So today I'm going to talk a little bit about the different physiology between pediatric and geriatric patients. I'll talk about how that impacts anesthesia and some helpful tips that you need to know when you're planning these procedures on patients. So let's talk a little bit first about why these particular patients are at an increased anesthetic risk. So both peds and geriatrics, they tend to have what's called a limited organ reserve, which is basically means the ability to deal. I'm going to write that here. Ability to deal. So basically what that means is that their organs, for some reason or another, have a decreased ability to respond to anesthetic challenges and anesthetic drugs. So this might mean that the heart is not as capable of contracting, maybe the kidneys are not as good as getting rid of wastes and toxins, maybe the liver is not as good as metabolizing certain drugs. So think about that. They are less able to handle our interventions and our drugs. Hence, a decreased ability to respond to challenges. So it's very common for anesthetic patients to become cold, to have low blood pressure, to have high carbon dioxide in their arterial blood, and these patients have a decreased ability to respond to those challenges. The whole idea behind our different body systems is that they're there to kind of, back us up and keep us in place, but these guys are less able to do that on their own, and you're going to need to support them. So, as a result of their different diseases, they have an increased sensitivity to anesthetic drugs. So maybe that means that you might need a lower dose, you might need to not use that drug at all, so that would be something to consider when planning these procedures. Because these animals tend to be just a little bit more sensitive, a little bit more fragile, you might expect to see a couple different things with relationship to drugs, okay? So an increased DOA, duration of action. The drug you give might last much longer than you anticipated in a normal, healthy adult patient, so think about that. We have an amplified effect, so you might give them the same dose as an adult dog to a very little or a very old dog, but it has an exaggerated or a very prolonged effect. So that would be something you also need to know. In relationship to prolonged effect, you might also expect to see a longer time to recovery. So you're kind of getting the picture here, right? They're a little bit more sensitive, they're a little bit more fragile. You just need to be able to adapt your plan and think about it critically. So here are some different age groups that you might need to split a patient into and kind of think about what specific problems that animal might have during its sedation or anesthesia. So the first group I want to talk about are neonates. So these are the babies. These are animals that have either just been born or were recently born up to the age of weaning. So it depends on the species you're working with, but most dogs and cats, you were probably looking at that point, 4 or 6 months old, at least at that point. So anything just born, 4 to 6 months old. Pediatrics, so this is an animal that's been weaned any point up until sexual maturity. Dogs and cats, you're probably looking at, 6 to 9 months at that point is when they go through puberty or sexual maturity. So weaning to sexual maturity, that is a pediatric. A senior pet is an animal that is in the last 20 to 25% of its life. So when you think of a senior animal, I want you to think of something like a 7-year-old dog, maybe like a 12, 13, 14-year-old cat. And the last one I want to mention are geriatric pets. So a geriatric pet is one that has really lived well beyond its time. It has lived beyond its general life expectancy. So for cats, we're talking, 15 to 20 years plus. For large breed dogs, really anything over 8 or 9 would be geriatric. For tiny little dogs, we're talking about 15, 16, 17, so old and crispy. And to mention further, all of these animals could be healthy, so they could be really old and be perfectly okay, right? they could have a subclinical disease. So maybe you don't detect it on physical exam or on their blood work necessarily, but there is some evidence of impairment. Or they could have clinical disease. So maybe they're coming into your hospital and they are already sick and debilitated, and you have identified what the problem is. So when you think about patients to plan for anesthesia or sedation, think critically about the age groups and about what problem might affect them at each stage, and make sure that during that time you are looking at their diagnostics and planning appropriately based on that and making appropriate adjustments. So now let's talk about some of those different alterations to body systems that each of those patient groups have, and talk about what kind of things we might need to keep in mind when we're planning in anesthesia for these guys. Let's start off with neonates and pediatrics. So it's not just things like blood sugar and hypothermia, right? There's a lot of different issues that these animals can have. So these are definitely some of the most common, but not an exhaustive list. So goes without saying that most neonatal and pediatric animals have low body mass. This makes sense, right? So this can be really challenging because sometimes this means that you have to anesthetize an animal that weighs less than 2 pounds, weighs less than 1 kilo. So this is challenging because you might not be able to find them under the drapes. They might be positioned very far back from the anesthesia machine or the surgeon. Might be very difficult to just see them under the drapes or make a depth assessment during anesthesia. The other problem that we see with low body mass are things like hypothermia. So let me start drawing some arrows off here. Hypothermia. Monitoring. Very difficult in these tiny little animals. Pediatric animals have a high surface area, SA, to volume ratio. It basically means they have more surface on their body relatively compared to the volume of fluid that they have on the inside of their body. So basically what that means is that they're gonna get cold faster. So if you have a huge amount of skin and you have not a lot of fluid, that kind of covering over that fluid, over your blood vessels, is gonna make you a little bit colder when you become anesthetized. So hypothermia, that's another problem. You're seeing a common theme here, right? Low body fat percentage. So pediatric animals don't have a lot of body fat, right? They're kind of born with what they have, and that over time, that's how adult animals get fat. Pediatric animals have more brown fat than white fat, and there is a really important difference between those two things. So brown fat is mostly associated with having a pretty high oxygen consumption and is important for a bunch of different processes. And white fat is more important for things like excessive calorie storage and energy reserve. So if you don't have a lot that helps you with energy reserve, it makes sense that maybe you're going to be predisposed to hypoglycemia, low blood sugar. And this is a thing a lot of us know about pediatrics, is that they tend to have low blood sugar, and this is one of the reasons why. They have a very high metabolic rate, so they chew through sugar and energy a lot faster than adult animals. So when you pair pre-anesthetic fasting with a high metabolic rate, you end up in the same territory, right? Hypoglycemia. This is why this is such a common problem for these little guys. Okay, more about the rest of the body. Low serum albumin. So albumin is a protein that is produced by the liver, and one of the purposes of albumin is to carry and bind to anesthetic drugs. So let's say you are a pediatric animal, you have low serum albumin, because that's just where you are in life. If you have low serum albumin, only some of your drugs that your doctor or technician gives you are going to bind to that albumin. And it is only the drug that is bound to albumin that becomes metabolized and eliminated. So you have increased free fraction of drug. So what this means is that you are going to have an exaggerated prolonged effect from that drug. Increased duration of action effect of drugs. So therefore, if your animal has low albumin, it might be necessary to dose reduce them or to increase the time between injectable drug dosings. Centralized fluid volume. So we talked a little bit about this up here, right? So centralized fluid means the fluid in their vessels tends to stay in their guts, in their organs, and not a whole lot on the periphery. Basically what this means is that these animals are more prone to becoming dehydrated. So in addition to anesthetic fasting and removal of water and food, we're further complicating this anesthesia because these guys keep their fluid quite centralized. So make sure that you perform a physical exam that not only includes basic things like TPR, but a hydration assessment. Okay, let's talk a little bit about their cardiac function and a little bit about their brain function too. So pediatrics, neonates, their cardiac output is heart rate dependent. And here's what I mean by that. So I'm gonna draw this equation up here, and we talked about this in an earlier lecture. CO equals HR times SV. Cardiac output equals heart rate times stroke volume. So in order to have a good cardiac output, a good performance by the heart, you need to have both an adequate heart rate. It needs to be not too high, not too low. And you need to have adequate stroke volume. So you need to have enough blood filling your heart for it to be pumped to all the tissues. Now, in young animals, it is more important for them to have a high normal or a higher heart rate to maintain their cardiac performance. So I don't really care if neonates and pediatrics have heart rates between, 100 and 180 in like little dogs, or in cats, something that's well above 200. That's totally fine. That's exactly what they need. Heart rate dependent. That being said, you want to try to avoid using drugs in these animals that deliberately lower the heart rate, and I'll talk about that later. Decreased sympathetic tone and vasomotor control. So young animals tend not to have a lot of sympathetic nervous system tone. They are in the rest and digest phase of their life, so to speak. Their job at this point is to spend time with mom and their siblings and nurse and get to play with other animals. They are in a state of parasympathetic dominance. So basically what this means, if they are in parasympathetic dominance, they have less sympathetic tone. We know that the sympathetic nervous system is very responsible for increasing heart contractility and rate, and also for increasing tone on blood vessels. If your blood vessel tone is low, your diastolic blood pressure gets low, and then your mean blood pressure gets low. So these guys can be prone to hypotension. They get low and slow on everything. Makes a lot of sense, right? These guys also have increased permeability of their blood-brain barrier. And another thing I will say about these guys that's very important to know is that they have very unique lung physiology. So these guys have an increased minute volume with a very compliant chest wall. So minute volume is the amount of air that an animal moves in a minute. It is the rest rate times the tidal volume. So you can find out from that how much they're moving in and out per minute. So they breathe quite quickly, and the chest wall is very compliant. It's very elastic, it's very forgiving. But if they are breathing very quickly and the muscles and bones are moving around very easily and the metabolic rate is high, these guys use so much energy to power their breathing. These guys are prone to ventilatory or breathing fatigue. It is very common for these animals to have rest rates that are much higher than adult animals. So it wouldn't be unexpected for these animals to have rest rates, 15 to 25 when they're anesthetized or sedated. That's just the way they are. But it's very important to monitor these guys over time, and especially in recovery, because they can develop fatigue, which means maybe they start slowing down, maybe their pulse ox drops, maybe their CO2 climbs, and these are all things that could impact their health and their quality of recovery. So you need to be monitoring those. So a couple of key points I think about when I'm anesthetizing neonates or pediatrics that will help you have a smooth and successful process. So we talked about how these guys are very prone to developing hypothermia. So it is very important to try to prevent that from the start. Now, if they're less than a kilo, they're gonna get cold. There is nothing you can do, but there are some things you can do to slow down that process and just protect yourself, okay? So try to cover the table surface. Use a rubber mat, use a towel, use something that prevents the patient from being exposed. Even covering your patient with a towel reduces radiation heat losses by up to 30%. So if you have nothing else, please try that. Cover the patient, cover the table. Use warm, forced water blankets or air blankets around or under the patient, depending on the size and what you are doing with them. Forced warm air blankets such as bear huggers only work when you have the special bear hugger attachment. It does not work to keep the patient warm if you just hose them with the attachment. So if you need those, make sure that you're ordering them in a timely fashion so that they arrive on time. Blood glucose sampling pre and post-op. So we talked about how these guys are prone to hypoglycemia and we're going to fast them before surgery. So make sure that you perform a blood glucose in a patient that's, less than 3 or 4 months old, both before and after. Once they get to 3 or 4 months old, most animals can make their own sugars from their body reserves. So it's okay to maybe lay off of that after that point. But if they're really little, make sure you check it before and after. And if they're seeming kind of quiet and dumpy post-op, feed them. Give that a go. They haven't eaten in 6 to 8 hours. That's not normal for them. You can go ahead and give those animals some food as long as they're not vomiting or, still critically ill. I think it's fine to fast them for a short normal time. So most animals, 6 hours is okay. 4 to 6 hours for most peds or neonates is going to be appropriate. Now remember, for emergent anesthesia, the emergent anesthesia always needs to happen first and then fasting kind of takes second. So if you are taking an animal to surgery emergently, it doesn't really matter about the fasting. I mean, it's important, but the surgery needs to happen to save the animal first. We talked about how these animals can have multiple problems like being cold, having exaggerated drug effects, having low blood pressure, having ventilatory or breathing fatigue. So it's really important to incorporate a variety of different drugs in order to help you spare your gas and provide pain relief to these animals. If you are using a balanced technique and using robust monitoring techniques, you're going to be able to prevent or at the very least catch problems before they start in these guys. Please monitor all animals and especially these ones well into the recovery process. We talked about how they can develop low blood sugar and you need to check it post-op if they're very little. We talked about how they get cold and we talked about also how they develop a lot of different issues. So it is important that after the anesthesia is over that you're checking them